Hey everybody, Tim Wyatt, clinical specialist here with the Aspen After Surgery Center. We are here with a former patient of ours, Sandra. Sandra, welcome.
Thank you.
How are you?
I'm doing well, thanks.
Awesome. So today's video is with Sandra talking about longevity and results with the Aspen treatment. Sandra was treated here for a left breast implant capsular contracture 12 years ago. Mm-hmm. And she's coming today for some of our updated videos on the Aspen treatment. Does it last? How long does it last? So thanks again for coming in so we can talk about 12 years later, you're still looking and feeling great.
I am, thank God, yes.
Awesome, awesome. So Sandra, let's give everybody a little bit of a background now, and correct me if I'm wrong. So we saw you back in 2008. You had originally prophylactically done a mastectomy. In that first surgery of the mastectomy and the reconstruction, you had come down with left implant contracture.
That's correct, yes.
So you were noticing the symptoms of the higher, the harder, the firmer breast, and it was the decision of you and your surgeon to surgically try and correct that a second time.
Exactly, yes.
Okay, so then you had the second revision surgery and it happened again.
Yes.
Okay, so this was the point that your surgeon had referred you to us here at the Aspen Center and said, try their non-surgical treatment, and we did a full course of treatment with you, and you did great.
Yes, thank God. I feel great.
And we were able to, correct the things that patients see the most, which is your left breast had sat higher, more noticeable in a bra or bikini. It was tighter, it was firmer. Did you have any pain in that breast? Do you remember? I know it's been a while.
Originally, it was some discomfort.
Uh-huh.
And what bothered me most was the actual location where it just totally lifted the breast up.
Right.
So it wasn't until I came here and you did what you do.
Right. And this was probably very noticeable in bra, bikini, bathing suit, low-cut tops. You could see how that left side sat up there. Yes. And was uneven. Yes. This is a classic sign for anybody who wants to do a quick assessment of, are my breast implants contracted? Do I have a problem? It's real simple. Look in the mirror and see if one sits higher than the other. If your breasts are not in the same spot at the top or the bottom, give them both a squeeze. If the high one is firmer, it can be contracture. Now in Sandra's case, because of the prophylaxis, there was no radiation, there was no chemo. Typically, radiation is a real big trigger for contracture. So patients that have had mastectomy reconstruction with radiation, pay attention to these types of things because you are more at risk for getting contracture than other patients who have not had radiation. So we did the treatment with you. We gave you a home program, you did some massages, things like that, and you were good. And now here you are 12 years later. Did you have to do a maintenance program to keep your results since then?
After this, no. I just followed your instructions and that was great. It worked out great.
Great. So that's another question that we get asked. Tim, do I have to keep doing these massages? Do I have to keep doing the treatment? Do I have to keep coming in? The answer is no, and Sandra is a testimony to that here we are after 12 years. She doesn't do maintenance massages. There's no touch-ups. We haven't treated you since. Right. And the results maintain. Rare occasions contracture can be re-triggered and you get a new capsule, but part of our program and that we teach patients is be aware of certain things to not re-trigger a new capsule. And that's part of our package that we give our patients is we educate them on things to help them not get it back. The experience of the actual treatment. Pain, discomfort, any issues while receiving the treatment? It
was, I would say, pretty comfortable. I didn't feel any pain. I felt great. It just helped so much because whatever discomfort I was feeling at the time, it just simply vanished. It was great.
patients will notice that that tightness or pain
Yes.
feeling that you're having in the beginning gets relieved
Yes.
because we stretch it and we release that capsule. It's very common orthopedic surgery, same thing, a tight knee, a tight shoulder, you do the treatment and motion and movement and the pain resolves. So that's another secondary benefit where patients who have discomfort or pain associated with their condition can see that result fairly rapidly in just a couple of sessions. Well, Sandra, thank you very much. It's so good to see you again.
It's good to see you.
You know, if anybody had any questions, would I be able to share your email or your contact information with them in case they want to ask you about your experience? Awesome.
Of course.
Great. Well, thanks again.
Okay, thank you.
Everybody, if you want to get a hold of us, remember consultations are free. Hit us up on the banner below for the website as well as the phone number. Make sure you go on our social media and like us. Go on our YouTube page and subscribe.